For our topic, today we'll be talking about risk assessment and the management of periodontal disease. By the end of this presentation, we'll be able to answer the question, how can identifying risk factors change the way we prevent and manage periodontal disease?
So this brings us to what is periodontal disease. Periodontal disease refers to inflammatory or infectious conditions affecting the supporting structures around the teeth, namely the gums, periodontal ligaments, and the alveolar bone. It all starts with gingivitis. That's the early stage, where gums become red, swollen, and may bleed. The good news is it's reversible. But if left untreated, it can progress to periodontitis, which involves irreversible bone loss, periodontal pocket formation, gum recession, tooth mobility, also called phimosis, and tooth loss. The main culprit? Bacterium plaque biofilm. This triggers your body's immune response, which over time can actually damage your own hard and soft tissues. So essentially, the body's defense system becomes a double-edged sword. And how do we manage periodontal disease? Through risk assessment. Risk assessment is how dental professionals identify who's more likely to develop periodontal disease. It looks at what's happening now, which is disease severity, and what could happen later, the future risk. Why this is important? It is because it helps create a personalized plan, determines how aggressive prevention needs to be, and guides patients' education, and sets a proper recur interval. The risk tools to consider a mix of different things, which are the clinical findings, systemic health, patient history. Think of it like a crystal ball, looking at the patient, present, and the future. So let's look at what really puts you at risk. Let's break it down to two big categories. There's the modifiable risk and the non-modifiable risk. And the modifiable risks are things you can change, which are smoking. Smoking fuels inflammation, worsens bone loss, and slows healing. Poor oral hygiene and plaque, which leads to bacterial buildup, triggering the immune system. And also stress, which alters hormones and weakens immune defense. Uncontrolled diabetics, which high glucose interferes with healing and increases infection risk. Local irritants, things like faulty restoration, calculus, rough tooth surface, or crowding. And your diet. Diet low in vitamins, high in sugar, you'll be feeding the wrong thing. And also, the non-modifiable risk. These are things you cannot change. You can only work around this. On this group would be age. More years equals more exposure. Genetics, some people are just naturally more susceptible to disease than others. Gender and hormones. While you're pregnant, menopause, in menopause or in puberty, equals to shifting gender response. Socioeconomic factor may limit access to timely dental care in different communities. So the takeaway from this message will be, while you can't change your age or genetics, you can control habits, hygiene, and health. Risk isn't a destiny, it's a guide. And with the right care plan, we can help keep those gums healthy for life.
Advances in periodontology. Over the last 10 years, periodontal science has made significant strides. We have depended on understanding of what causes periodontitis, how genetics and lifestyle can increase risk, and how gum diseases can affect overall health, not just a mouth. Treatment has also advanced. We now use antimicrobial therapies alongside traditional care and apply cutting-edge surgical techniques like regenerative procedures, cosmetic gum surgery, bone regeneration around implants, and advanced soft tissue management. These innovations have truly transformed both the medical and surgical aspects of periodontal practices, leading to more effective and comprehensive patient care. Moving on, management of periodontal disease. So periodontal disease isn't curable but can be managed. Gingivitis is reversible with good oral hygiene. If the client is taking care of his or her mouth regularly, then the gingivitis is curable. More advanced cases may need deep cleaning, surgery, or regenerative treatments like bone and gum graft, GTR, or laser therapy. Newer methods like PRF, PRP use the body own healing factors to improve recovery. By all these means, healing can be improved and reduced post-surgical discomfort very easily. Thank you.
Advantages, disadvantages, or limitations of the risk assessment approach. Risk assessment in periodontal care is very important to identify those individuals who are at higher risk of developing periodontal disease. Tools like Periodontal Risk Calculator help to identify factors such as smoking, diabetes, pocket depth, early diagnosing and intervention of the periodontal disease. High-risk groups like elderly, low-income individuals, pregnant women, smokers, and those with medical conditions like diabetes, cardiovascular disease, cancer, or immunosuppression diseases. This population may require frequent dental visits and customized care strategies. With the risk assessment into routine, applying the risk assessment into routine practice along with patient education on daily oral hygiene care, brushing, flossing, rinsing can help improve both oral and systemic health outcomes. Uses in dentistry today. Integrated approach combined with the conventional methods with advanced therapies. Ultrasonic scaling is the first line treatment for plaque and calculus removal. Laser therapy decontaminates pockets and promotes healing. Localized antibiotics like Arestin have antibacterial action and inflammation control. Thorough diagnosis like probing, radiographs, medical and dental history review identifies the underlying causes such as poor restorations, trauma, or systemic conditions. Sequential therapy is important for multiple visits for deeper pockets. Minimally invasive tailored plans can improve the outcomes like reduced pocket depth, better tissue health, and long-term success.
For future direction in periodontal care, there are several exciting areas of research. First, we have precision diagnostic biomarker tests that are being developed to detect early gum disease more accurately. Second, scientists are working towards a better understanding of genetic factors. Third, regenerative medicine, which is a promising field focusing on using techniques like stem cells and growth factors to rebuild lost bone and gum tissue. Fourth, we have host modulation therapies, which aim to manage the body's immune response and inflammatory response. Finally, probiotics, which are being studied in a way to restore a healthy balance of oral bacteria and oral gum health. Together, these future directions show how periodontal treatment is shifting towards an earlier detection and personalized care. Let's take a look at some fun facts about risk assessment and the management of periodontal disease. First, genetics plays a big role. Even though bacteria is the main cause of periodontal disease, about 50% of risk may come from inherited traits. Studies have been shown on identical twins that about half of somebody's risk is actually inherited and linked to their own body's immune response. Second, we have saliva biomarkers for early detection. It can be used to detect periodontal disease early. Scientists are developing tests that use saliva biomarkers, which means we can pick up signs of gum disease quickly and painlessly. Third is stem cell therapy for regeneration, which is a future direction. Researchers are now exploring how stem cells can regrow bone and gum tissues that are lost in periodontitis, something we currently can't fully restore with current treatment. And finally, we have host modulation therapy, which takes a different approach, which involves therapeutic concept that aims to change the state or function of the human body as a host treats a disease. It aims to restore the balance between pro-inflammatory and anti-inflammatory factors. To summarize, our main question was, how can identifying risk factors change the way we prevent and manage periodontal disease? The answer is that identifying risk factors help us determine who is most at risk for disease progression by looking at both at modifiable factors like smoking, diabetes, and oral hygiene, and non-modifiable ones like age and genetics. We can design personalized prevention strategies and patient education. Risk assessment also guides us in creating tailored treatment plans and recare intervals, making sure that each patient gets the level of care that they truly need. Overall, it shifts periodontal care from reactive treatment, where we only act once damage has occurred, to a proactive, where patient-centered approach focuses on the prevention and stability and better long-term oral health outcomes. Here we have a slide of all of our references. And thank you for listening to our presentation today.